Welcome back. Well, losing your sight can be one of the scariest experiences a person has, and Jen Tome is here with more information about 2 ways it can happen.
Liz, 2 major eye diseases and leading causes of blindness are macular degeneration and diabetic retinopathy. But there is hope if you have either of these diseases. Dr. Shalise Kasil, the chairman of ophthalmology at UMass Memorial, joins us live via Skype to learn more about the 2. Thank you for joining us, Doctor.
Thank you.
Well, let's start with explaining what they both are.
Yes, as many of you may be familiar, the retina is the photographic film of the eye that's attached to the inner wall of the eye. It's really no thicker than tissue paper. And the 2 diseases in particular that you're referring to, age-related macular degeneration, which is the #1 cause of blindness worldwide, and diabetic retinopathy, also a very common cause of blindness worldwide, are diseases that affect that photographic film of the eye.
So what are the developments in diagnosis? How do you determine which is which?
So we are able to, in clinic, to directly visualize the retina, which is a part of the central nervous system. And so we can look at those tissues directly with our standard instruments as eye doctors. But in addition, we have additional diagnostic equipment that's available these days. Some in private practice, but some in specialty centers like ours and many others across the country, where we can take pictures of that very fine tissue and then understand exactly the changes in that tissue, and then based on those studies or imaging studies, we can then take appropriate therapeutic steps for patients.
So when do you start routinely looking for both of these diseases, or do you routinely look for them?
Yes, we do. That's a great question, in fact. Many times we get calls directly from primary care physicians or endocrinologists or general ophthalmologists wanting us to further evaluate patients of theirs who may have either macular degeneration or potentially diabetic retinopathy. So most often in an academic center like ours, we have referrals from many different sources who want their patients to be evaluated. In other instances, we have patients who may hear of these diseases or have a family history, and they directly come to our clinics to be evaluated.
Can you prevent them?
I'm sorry?
Can you prevent them?
That's right. Prevent them, or in some instances, treat them with not only standard therapy, but also cutting-edge clinical trials that we're developing here at UMass to treat both of these disorders.
Can you reverse any of the symptoms?
That's a wonderful question, and the answer is, in some instances, if we catch the disease early enough, we can actually outrightly arrest and reverse the disease itself. But in other instances, when the disease has progressed further, we can at least nowadays, in certain forms of macular degeneration and diabetic retinopathy, stop the disease. We may not be able to reverse in the late stages of the diseases yet, but there's obviously great active research going on in this area.
So it sounds important to catch it early.
That's right.
Okay, well, thank you, Doctor, for joining us and giving us important information today. Now, if you have a question you would like to ask a doctor during a live Skype interview, please email us at housecalls@cbs3springfield.com.